or categories of illnesses. And I understand that this is a national issue, even though we have gone a long way to try and correct some of those problems in New York State. I'm concerned about it on a national level. All of us may have relatives in other states and are concerned about where our children may live or go to school. And so I think that this is really a nationwide issue, not just something that we can say, oh, we're doing this in New York so we don't have to be concerned about it. The idea that there is such a stigma about getting people to seek help for mental illnesses and the burden of the cost of care on families is absolutely enormous. And I would like to know what's being done to assure that there is parity on this issue between mental illness
Thank
and
you very much.
There are two pieces of legislation, one sponsored by Patrick Kennedy that has passed the House of Representatives, and one passed by Ted Kennedy, sponsored by Ted Kennedy, that has passed the Senate, that would provide health care parity relative to parity between treatment of physical illnesses and mental illnesses. And what it does is it doesn't require an insurance carrier to provide coverage for mental illness, but it does require the insurance carrier, if it does provide coverage for mental illness, to provide it on the same terms as for physical illness. That is to say, the same deductible, the same copay, etc. We have passed versions in both the House and the Senate. As far as I know, the term we use is conference, and we have not yet conferenced the two, so it is not yet law, but it is something that I think will pass in this Congress. I hope that answers your question.
You talked earlier about, and there's been much discussion about a committee that would establish national standards for minimum health care. Is that something that such committee would be looking at?
That is an issue that, as I said before, the bill, H.R. 3200, proposes 3 levels of care, and there is a committee that would, in effect, establish minimum standards for each of those 3 levels. And yes, it is very possible that the committee would make recommendations with respect to one of those levels and what it would do for mental illnesses. Okay. Thank you all very much for coming tonight. I appreciate you being. Thank you.